So osteoporosis is a condition that develops that means that your bones are easier to break than those of the average person. Okay, so what we're basically trying to do is help prevent that bone loss that leads to osteoporosis, but also once you're in that category and that bone has gotten to a spot where you're at a higher risk or even a very high risk of breaking things, we have medicines available that we can employ that can even in some cases help build bone so that you have less of a risk of breaking.
Osteoporosis can occur for a number of reasons, some which include diabetes and rheumatoid arthritis. Those who are most at risk are postmenopausal women.
When we're kids and in young adulthood, we're building bone like crazy. And then when you're in your middle age, you're kind of just sort of stabilized. And then when menopause happens, things really start to decline from a bone perspective. So that's one of the big things that puts people at risk.
Fracture risk assessments may be completed on osteoporosis patients. This online screening questionnaire identifies what may increase your risk of getting osteoporosis. The best way to determine if an individual has osteoporosis is to complete a bone study, which is also known as a DEXA scan.
So though when we're doing a bone density study or DEXA scan, we sample certain different parts of the skeleton by taking x-rays of those parts, it is a disease of the entire skeleton, meaning that we just use those certain spots to give us an idea of what's going on everywhere. The most common way to screen for osteoporosis is with that DEXA or bone density test. So we recommend a DEXA scan for every postmenopausal female at the age of 65 or later, but you might get it earlier than that if you have some of those other conditions that predispose to osteoporosis also.
Habits such as excessive smoking and alcohol use can increase your chances of osteoporosis.
The big thing I like to stress with young people who are trying to prevent osteoporosis, other than moderating any kind of smoking or alcohol use, is to make sure you're getting a good amount of calcium and vitamin D through your diet, because those things can help you build bone during that time in your life, childhood, teenage years, 20s.
Ways to help aid and combat the effects of osteoporosis are by ensuring you have the correct intake of calcium, along with doing weight-bearing exercises.
For the general public, as far as osteoporosis is concerned, if you're young, do everything you can to keep that vitamin D and calcium level good. Get that weight-bearing exercise, build your skeleton while you can. If you're in middle age, be thinking about your risk, be thinking about the possibility. If you do break something, talk to your doctor. And if you're getting into that later stage of life in the 60s or older, then definitely be reaching out to your primary doctor and talking about getting a bone density study, or at least doing the FRAX to make sure we know whether you're at high risk or not for osteoporosis.